Well, it's long been believed that caffeine exacerbates irregular heart rhythms, but a new trial has found patients with atrial fibrillation can have a cup of coffee without doing harm. The host of Radio National's Health Report, Dr. Norman Swan, has the details.
This fascinating trial in South Australia where they tested this proposition, and it was quite a difficult trial to do because you actually had to ask your control group to abstain from coffee or decaffeinated coffee or caffeine-containing products, whilst the other group took coffee, about a cup a day. And the condition that they have was a common abnormal rhythm of the heart called atrial fibrillation. And this can affect people from kind of middle age on, and it's a serious arrhythmia because it's where the top two chambers of the heart quiver and don't transmit information to the bottom two chambers, and the heart runs very fast and irregularly. And you can get blood clots forming on the left side of the heart, which then can spin off to the brain, causing a stroke. So it's not a trivial arrhythmia to have. And people were wondering whether coffee made atrial fibrillation worse, because they can get rid of atrial fibrillation, but it tends to come back. And this was a study of recurrence of atrial fibrillation. So one group had coffee, and one group did not have coffee and did not have any caffeine in their lives. And they monitored them. And the group with coffee had fewer recurrences of atrial fibrillation than the people not on coffee.
Very interesting. Do we know why?
There is evidence in other areas that coffee is not necessarily bad for your heart, that coffee drinkers, assuming that they're not smokers at the same time, because that's the confusing thing with coffee is, it used to be that coffee drinkers were smokers too, and that's not necessarily true anymore, is that there are fewer instances of heart attacks and strokes on people who are taking coffee. So coffee is not necessarily bad for the heart. What is known to be bad for the heart in terms of atrial fibrillation is alcohol. And that's also an Australian study which showed drinking alcohol can make recurrence of atrial fibrillation worse. So coffee okay, alcohol not.